Happy Easter, my name's Toby, welcome to my vlog. We're in the middle of the last Trust Board meeting of the public sector year. So it's all go, there's a new board assurance framework being agreed. Thanks very much to Phil Gowland and the governance team for developing that. We're looking at some of the risks that are on our risk register. You remember we've got 2 or 3 times more risks now on our risk register as we try and get to really focus our capital investments on things like ligature risk and issues of safety for staff where you work. So quite an intense board meeting, but an opportunity to look ahead with our forthcoming financial plan and to really make a difference to some of the challenges that we face. So there's the opportunity to make sure that we're investing to bring equity to our learning disability services, particularly levelling up, as they say in North Links, bring equity to some elements of our older people services across Rotherham, Doncaster and North Links. And then really excitingly, the start, or maybe better put, the continuation of our peer support journey. Our colleague James on the screen tells me he's been working with us for over 10 years. I know there's perhaps 24 peer support workers currently working in our organisation, as I mentioned a few videos ago. Really exciting to see the expansion of that in line with the NHS workforce plan. These are all the changes that we're able to make because of the hard work that you and all of us have done to get on top of our finances, even as the NHS goes into another very challenging fiscal year. Now, before I carry on in that vein, I'm going to pause for what I guess is a public health message, and for once it's not me talking about flu, but it is me talking about measles. There are lots of people in our organisation who have put a lot of time and attention over the last few months into a renewed campaign to make sure that we are tackling measles in our community. Just the images on the screen are a stark recognition of the signs and symptoms, but measles is a very serious condition, and within our country and within our area at the moment there is a real risk of renewed outbreaks. So it's really important, and I know it's been in staff comms, but I make no apology for renewing my request that you take a look at this slide and think about if it affects you, if it affects your family, your kids, your nieces and nephews. It's so important, even if you missed out on measles immunisation at an earlier stage of your life, that you take steps now with your GP to get yourself vaccinated. Please, it will be heartbreaking to see the effects of measles become widespread in our community. And that focus on what really matters has been a running thread for me of this week. We've been doing some really important work with each of our care groups, looking at their work to deliver core national patient access standards. Colleagues, I'm absolutely delighted that for the first time in a number of years, perhaps very many years, Ardash is in a position where, because of your hard work over the last year, we are now meeting some of those long-term plan mental health standards. I've talked before about virtual ward, but this is a focus on talking therapies, on contacts with children and young people, on perinatal mental health and on the community mental health standard. We are really making progress in those areas. For talking therapies, we know how next year we could meet the national access standard. We're committed to meeting the recovery standard, but the board is also clear that if to tackle health inequalities, we need to make reasonable adjustments that put some of those thresholds under risk. We will preference the tackling of health inequalities. But what you're listening to, I guess, is a thank you, not just to the clinical staff involved in meeting these standards, but to the administrative staff and the managerial staff who have spent extraordinary amounts of time, particularly over the last 3 months, getting us in a position where we look after our patients to meet those standards, but also we have this data to prove that we are meeting those standards. Some of our deputy care group directors have been involved in that are pictured. You might be wondering why Andrew Brankin's picture is larger than his colleagues. Well, that's because he is now known as Two Contacts Brankin, because the community mental health standard we work to is based on having at least 2 contacts with the patients in our adult services in our care. And I know how hard Andrew has worked in Rotherham, as colleagues have in other places, to make sure that we have got over the line. I know in North Lincolnshire we got over the line just yesterday. So this isn't about hitting targets and missing the point. This is about our organisation being able to meet the commitments that we've made to our patients, and also it is about our organisation getting recognition for the hard work you put in to work with our patients and make sure that we meet those standards. So it's difficult to say thank you. Sometimes it feels a bit odd to be proud of things that we would all want to see happen routinely, but it's a big achievement. So thank you so very much for what you have done. So there's always a risk that I end the film by saying, right, enough of the year just gone. Thank you for all that. Now on to the next thing. That, of course, is precisely what I'm going to do. I think there's a really exciting year ahead as we look to make a reality of those things in our promises. So not just that recruitment of peer support workers, not just that expansion in our research work, but also delivering on Promise 19 around out of area placements, delivering on the shorter waiting times that we are investing to achieve with Promise 14 and the rest. So exciting times ahead. I know sometimes it's tiring, but thank you again for what you are doing to help this organisation nurture the power in our communities.